Hi, I'm Dr. Srivatsa Lokeshwaran. I'm the lead consultant interventional pulmonologist and lung transplant physician at Aster Whitefield. I'm happy to be here today discussing about a very relevant topic, that is lung cancer and smoking. And why does this have relevance today? We see that lung cancer is one of the biggest killers, especially in today's age where it's involving more and more of the younger population. And we all know that one of the most commonest cause for lung cancer is smoking. So what makes it very peculiar is that it is a preventable type of lung cancer. So if we strike early and wean away patients or people with the smoking habit, we will be able to reduce the burden of lung cancer to a large extent. And smoking alone causes a significant amount of morbidity as well as the mortality associated with these patients. Some very interesting factors or pointers which we have noticed is that there is an increasing trend or change in trend in which the lung cancers are presenting nowadays. Earlier days, it predominantly affected males and roughly to a ratio of 3.5 males to 1 female. And now there is a narrowing of that bridge to 2.5 incidents in males, basically telling that the increase in frequency of lung cancers in females. This is possibly explained by the increasing habit of smoking among the females. Also, there can be changes in the way the lung cancer presents in both these sexes. One is that lung cancer usually used to present in the central part of the chest as compared to the distant part of the chest, and this can be because of the changes in which cigarettes are sold nowadays. So we have filtered cigarettes, low tar cigarettes, which basically puts the carcinogens in the distal part of the lung or the periphery of the lung. This not only makes it difficult for a physician to diagnose it, you need newer age technologies which are able to navigate your lungs like a Google map to the periphery of the lung, where we are able to biopsy these lung cancers with special tools which are available at Aster Whitefield and confirm the diagnosis of lung cancer. And we also see that lung cancer not only presents in smokers, it is also common in non-smokers as well, where there are many patients, young patients, who come to me and say, how did I develop this? I've never been smoking all my life. It is a fact that has to be established that not only smoking but non-smokers also have various genetic mutations that predispose them to have lung cancer as well. And these tissues which we acquire to study the lung cancer also serve as a template, because there are a lot of mutations, and these mutations in this present era drive therapy for lung cancer patients. So tissue should be sufficient when you come to the pulmonologist, so that we work very closely with our medical oncologist colleagues so that we arrive at an answer to manage your lung cancer problem sufficiently. So what do we have at Aster Whitefield to offer you? First and foremost is our smoking cessation clinic. So people who are very early on in the habit and have the intention or the strong desire to quit, we can clearly help you quit by using various behavioral therapies as well as medications to wean you off the habit. And I think that is the far most important point. The second is to help you diagnose lung cancer early. So we use special low dose CT scans to screen you when you have the habit, so that we identify these lung cancers very early on, which goes a long way in helping the patient. Third, we help to diagnose. So people who already have a suspicious, a lesion in the lungs, which your physician or your radiologist tells you, you can always bring them to me so that I will be able to get the tissue for you and type the type of lung cancer you have, and also work with our oncology colleagues in helping them deliver the best form of care for your lung cancer. So for any such queries, please reach out to us at Aster Whitefield Hospital, Department of Pulmonology, so that we can help you better. Thank you.